Okay, I hear that. Okay, good. Okay, good. So here's our website, and under the insurance part, health insurance part, everything is here. So we are talking about the health insurance for international students, and this is called university. Is there anywhere here? UHIP, right? So somewhere to should talk about the health insurance, university health insurance. Okay, so yeah, here. Sorry about that. So it's called University Insurance. Sorry, University Health Insurance Program. Uh, because this is only for international students, and the reason for this is before you come to Canada, you could have already heard that Canadians are covered by public health insurance, but it is actually running at the provincial level. So each province has their own insurance, but different province has a different policy to manage their provincial insurance plan. So some province would allow international people to join as well with a fee, and some is free even. But some province only cover local people, say permanent resident to Canada and a Canadian citizen. They don't allow international students to join. So Ontario is this kind of situation. So Ontario Health Insurance OHIP doesn't allow international students to join. So since all university in Ontario started recruiting international students about 3 decades ago, universities didn't really pay much attention about this part, but after a while they realized that international students need to be covered by insurance, otherwise there will be liability to universities. So since then, all universities in Ontario settled a plan agreement with a private insurance company to provide this insurance coverage similar to Ontario Health Insurance Plan. So it's called University Health Insurance Plan, UHIP. Actually, now there's a UHIP website. I'll show you that later. So this plan covers very similar as a local Ontario health insurance plan. And it does cover mainly about, I will talk about coverage. First, I will talk about the enrollment. Universities make this as a mandatory. So you are required to join. Basically, the enrollment is automatic. So you do not need to do anything. Once you are enrolled in the system, the university will put you into this insurance, and the fee will show up in your student account. And then since it's mandatory, mainly you have to be covered under this. Some students come in with international coverage, but unless it's very similar to the one we have in Ontario, otherwise you won't be able to opt out. And their information about the coverage, I will talk about who you could request to opt out this insurance. But in general, it's a very huge coverage. So in general, the general international insurance won't be able to be qualified for that. So anyway, there's a part about that. I'll talk about that. So the enrollment will be automatic, so you do not need to worry about that part, and you cannot do anything for enrollment. It's there, and then it is not required for entering Canada, so you do not need to worry about to have it before you enter Canada. And once it's enrolled, you will receive an email from the company who provide this insurance. That is Manulife company. They have a branch. They have a friend about this coverage for UHIP only. So you will receive an email from this email here, and it could go to spam junk mailbox. So you do need to search for that. And the email will tell you how to print your UHIP card. But it doesn't really matter you have the card or not, you're covered. So the coverage starts from the 10th of the month before your program starts. This is the enrollment start date. It's under this exchange non-degree because those students enrollment will be counted by term. So that's why it's under here, but that applies to everyone. All your enrollment will start, your coverage will start. Say if your program start from September, the coverage actually start from August 10. So August 10 is the time you start your coverage. You come to Canada or not, it doesn't really affect this one. So basically, if you come before August 10, you won't have this insurance yet. You need to arrange something yourself because you're not a university student yet. So university is not really worrying about that part. When you come to Canada, you arrange that. And if you arrive after August 10, then your coverage starts from the date you enter Canada. Even you don't have everything settled, you haven't paid the fee yet, and paying the fee to this doesn't affect your coverage because the UHIP fee is just part of your activity fee, university fees. Whatever you pay university, it doesn't really go to the insurance company yet because university will pay them at the end after we got all the money. Then we send the whole package to the insurance company. So they don't worry about this fee payment, and you do not need to worry about this part either. Because university will tell you that you need to pay. There's a deadline you need to pay, but your coverage starts either you paid or not. And even if you don't have the card printed yet, your coverage started. And if you need to see doctor, you just pay and keep the receipt. Then you can claim the expense after. Okay, and for the card, basically, and actually you would know your ID, your UHIP account number already because it's a very general format. The format is I think it's QU. I'll put it in the chat. QU0 plus your ID number. Okay, so this will be your ID, and you have the card or not. The card is not a physical card; it's just a printout, right? So once you print it out, it's just the number will be printed on there. But you know your number. If some doctor would accept the number, it's fine. Otherwise, you pay at front and then keep the receipt and claim the money back later. Okay, so that's about enrollment. And about the coverage, it's under this section. And in general, it covers your visit to doctor, and if you are in hospital, will be all covered. And it's very same as OHIP. And understand here, we are not trained insurance people, right? So we just give you general information. But the most detailed coverage information will be on UHIP website, and you can always contact them. See here, you can contact them to check to get all kind of question answered. They are insurance company. Okay, they are the one to help you to understand. So just go back one page. Okay, so the coverage exemption is here. It's a very, as I said, it's a very high level insurance plan. So in general, it won't be you won't be able to opt out. But if you are really under, see, there's a Saudi Arabia. I know this for years. They cover everything. So then you could submit this request form, and that's basically is, I think. And cost is here. You will know. But understand, UHIP is not covering some, if you're a regular degree student, you will see two charges in your student account related to insurance because there are two health insurance coverage. One is this UHIP covers basic visit to doctor, similar to OHIP, because all Ontario local students, they have this OHIP already. So university provide this to help international students to get coverage. So that is one part. But for all those local students, the OHIP doesn't cover prescription, doesn't cover dental, those kind of expense related. So that's why university has a supplemental plan. For local people, you will have that supplemental plan, and to help the dental part, vision part. So this also good for international student, regular degree student. You will be they are mandatory as well. So you will see these show up in your student account. The fee will be there as a supplemental plan. So you see two insurance coverage. But for exchange student, it's arranged differently because you come for only one term. So this supplemental plan is run by, for undergraduate is AMS, for graduate student will be SCPS. They have a different policy for people who can be enrolled to this plan. So for exchange student, you should check with your program faculty, program manager, your faculty staff to get information about if you are in the plan. If not, are you able to join? They have different policies. So you could also contact this supplemental plan office directly. They could help you as well. For AMS is this one, and you can find all the links from our website. This is SCPS for graduate students. Looks very similar, but except okay. So it's the same company provide those supplemental plan, but for exchange student, it depends on the program. So you want to find out if you are in there or not, and if you want to join, are you allowed to join? All those things. We're not really advising on that part because this is not very much for international students. This is for all students. Okay, so that's about the supplemental plan, and UHIP doesn't really cover travel. So UHIP, as I said, is a provincial level, like Ontario Health Insurance Plan. So they don't really cover travel, very limited. But the supplemental plan, the one from undergraduate association, graduate association, they cover some travel. You will learn more under their coverage part. Okay, and there's a section about preferred providers. So here, understand, UHIP is an insurance. It's not a service provider. Okay, UHIP doesn't give you doctor. They have no clinics. So UHIP is insurance. They cover all those eligible expense. So visit the doctor is all covered, but because this is not a government official provincial insurance, it's a private insurance at the end. So not all the doctors accept your UHIP card. By saying accept, it's not about they don't take you as a patient. They just don't accept that UHIP card to exempt you from the payment. They could still ask you to pay, the same as I said when you come before you have the UHIP card. So if you go to some doctor, they say, we don't take this card, you have to pay. That's fine, as long as you understand you are covered by this, for this expense, you just pay and then keep the receipts come out, and then you claim the money back later. So the reason there's some preferred provider is basically saying those offices, those doctors would take this UHIP card and they will claim the expense to UHIP after you visit, and they don't need you pay first. So for example, the wellness center here, student wellness center here. So the student wellness center service in Queens, just in our building, and they are one of clinics. They do doctor clinic the same. So you go there, they see your UHIP card, they won't charge you. They will get all the fees from UHIP. So that's just one, but majorly, most of the doctors understand this UHIP already, this because it's running for 3 decades already. So they will take, only few of them, they don't take the card, you pay first. But yeah, as I said, you make sure you understand this is covered, then you go pay. I keep saying you need to understand your coverage because it happened in the past. There was a student just called ambulance, and then at the end they claimed the fee to UHIP, and UHIP say we don't cover ambulance. So there's some restriction about what kind of ambulance will be covered. So then at the end, that student paid some of the fee from their own pocket because they didn't check. So you want to make sure check those coverage details. If you're not sure, just call Calvin, the provider, to ask them to make sure it's covered, and then you go pay. Otherwise, if it's something you have to pay, no matter it's covered or not, you have to pay, right? I'm just saying, in case it's optional, then you would decide to go for it or not. Check the coverage first. Okay. So this is about travel. And also for students coming with a family member, so you will need to add your family member. You could, because the reason I keep saying about the enrollment adding, because this UHIP is a private insurance, but it's a very, very good deal because they got $1 million from all the university, right? So it's a very good deal compared to all the other private insurance. So you could buy private insurance for your family member, but if they could join UHIP, it will be much cheaper. Okay, so that's why it's always good to add your dependent, but you do need to request to add your dependent if they are here with you in Canada, because we don't know your family member come or not. You are mandatory join. We know you because we enroll you to the program, and then we add you to the coverage. But your dependents could come in later or together. We don't know. So you need to add your dependents to this plan. You need to request. So here's the requirement. You need to add them within the first 30 days when they arrive. Basically, they will be covered the same from the date they arrive in Canada. So submit this form. Any more question about the procedure, how to process, you would email to this email, uhip@quincy.ca, because this office is not processing the enrollment. Say if you requested to add your dependents and they are not showing up in your card yet, so you can email to UHIP to ask what's going on. And after you added your dependent, they will show up on the same. You just go back to online to print your UHIP card again, and then you will see their names under your coverage, under your card, the same card. But they will pay fees. Okay, they have individual fees to pay. So yeah, so check about that. And I think that's mainly about yeah. And the support part, you can see common contact information. UHIP, yeah, UHIP website. You can find their information. Yeah. Okay, so I think I will stop recording. Let me see how to stop this one. Okay, I will stop recording here. Okay, then we will open